everybody. You're very welcome to this webinar to launch DOCUS's research on mainstreaming disability into development and humanitarian practice in the Irish INGO sector. My name is Sarah O'Toole. I am the CEO of CBM Ireland. I'm also Vice Chair of the DOCUS Board and Co-Chair of the DOCUS Disability in International Development Working Group. You're all very welcome here today. We're delighted to see such a great turnout from across the sector, both from Ireland and abroad. So welcome to our overseas visitors too. Just to quickly go through the format of the event, we'll have a 4-speaker panel, and we will then have some Q&A after that. So opportunities to ask questions. I would ask everybody to make your comments through the chat box, but please pose your questions through the Q&A function on the Zoom call here. This event is being recorded, just to make you aware of that. And today I'm delighted to say we have sign language interpretation, and we also have live captioning available for those who need it. I have placed a link in the chat box for the live captioning. So, and we will repeat that as the event continues. I would just let you know that as for those who aren't speaking, our panelists will turn off their cameras and microphones so that we have speaker only and our sign language interpreter only on screen. So without further ado, I'd like to introduce our first speaker. Suzanne Keating is the CEO with DOCUS, and Suzanne, I'd like to invite you forward now to make the opening remarks and ask all other speakers to turn off your cameras and mute. Thank you.
Brilliant. Thanks very much, Sarah, and good afternoon. For those of you not in Dublin, it's a glorious winter's day here, so I hope you are all safe and well in these rather extraordinary times. Just to say, I'm very honoured and delighted to welcome you all here today for the launch of this DOCUS report on disability mainstreaming and inclusion. I know that the working group have been working hard on it all year, in fact. Let me tell you, they didn't let minor things like a COVID pandemic thwart this exercise, because of course they were actually launching this survey that makes the background to this report literally the week that the COVID pandemic hit Ireland and we all went into lockdown. So just like you'll see from all the brilliant case studies in the report, I can assure you that the DOCUS working group is a resilient and indeed a courageous bunch. And because of their hard work, we are here today to really kind of look at and explore this really excellent report. Please make sure to read it as soon as you can. It will be on our website, but perhaps more importantly, let's decide by the end of today that there's some clear recommendations that we need to act upon. I suppose for me, look, I'm no expert in this area around people with disability, but when I was looking through the report, a couple of really important threads came out to me. The first is that whilst one of the recommendations talks about the importance of drivers of change to really make this issue visible, I was also struck by the thought that really this is showing how critical international NGOs and their local partners are to this issue. In fact, they are showing the value of international NGOs, of being these drivers of change. They're doing that by the work they're doing it on the ground. We're doing that through the advocacy back at home. And I'd suggest we're doing that by making the connections back here in Ireland. So really, I'd like to kind of commend you all that not only we know we need drivers of change, but you are the drivers of change. And it shows really the value and importance of NGOs and of civil society. But it does perhaps suggest that we need to continue to work closer together, whether you're a specialized agency or not, going forward, it's got to be that collective piece that will help us shift the dial, which will help us make visible things that at the moment remain too hidden. Secondly, then, for me, every webinar I go on, we kind of start with saying, oh, COVID. We know that really the impact of COVID is more about exacerbating those structural injustices that were already there. And we really see in this report that it's added to the challenge and obstacles behind people living with disability. I was really struck, for example, there's a lovely case study of a Pakistani lady, probably get the pronunciation right, her name is Miss Bibi, I think, and showing how as a result of COVID, she's been moved out of her hostel and is really facing that isolation that in fact so many of us are facing during this lockdown. But let's remember that COVID is also presenting huge opportunities for us, and this report really shows that. In particular, I think, and I was struck, I suppose, from my own lockdown experience of really hearing much more in Ireland about people living with disability. Equally important, we're hearing about the carers, we're hearing about the communities and the social services out there to support and protect them to live full lives. I suppose, yeah, it is that thing that I've been struck just how dedicated and incredible people are, and that our local communities are to care for people with disabilities. And I think it's not only struck a chord with me, but many people in Ireland. And it really makes me think we've got a real opportunity there to make that connection with people living with disabilities overseas as well. To really show the kind of impact of your work, but also that empathy, so that we can build on that public consciousness to really, as I say, make the hidden more visible. And thirdly, then, another important issue that I think keeps raising its head for the sector, whether it's through the Black Lives Matter movement, the Me Too movement before that, and it's surely that need to look inward, to look at ourselves first, if we're to tackle real structural injustices around stigma and around behaviour. So we have to attune then to our own power structures, our own unconscious biases, and indeed the lack of diversity within our own organisations. If we're to genuinely, whilst asking politicians and others to shape policy more around reaching the furthest behind first, we need to be ready to do that ourselves. And I think this report and its recommendations really brings that out very strongly. So after today, then, it'll be important, I hope, that this report doesn't sit on our shelves. Although, yeah, I was suddenly struck, we probably don't have shelves anymore because we're all virtual, but you kind of get where I'm coming from. But let's be very clear here. There's no excuse now. This report shows that, there is guidance there. There's some incredibly dedicated specialized agencies. There are a lot of people out there that are willing to share and listen and learn to make a real difference in both humanitarian and development contexts. We need to make sure people with disability take center stage so that they can live lives to their full potential. But equally important, again, I was struck in this report, they could teach us a thing or two. They could teach us a thing or two about resilience and about courage. And that's what I hope you'll get a better sense and a flavour from our panel discussion today. So finally, then, a huge thanks to all who made this report possible. To Charlotte, of course, who's been busy away and producing this great report, and her supervisor at UCD. To the DOCUS members who all participated in the survey. Of course, to Sarah, and the dynamism of every member on the disability working group to show what's possible, really, through collaboration. And of course, lastly, to thank IrishAid for their contribution. In conclusion then, I know that for many of us on this call, 2020 has been one of the most challenging years. And it has, as we know, brought even greater risks of discrimination on the rights of people with disabilities. But let's not waste a good crisis. Let's see this as an opportunity to reimagine our world and continue to be that critical change maker that allows us to build back better. That needs to include ensuring that the most marginalized and their carers play a full and active role in our societies. So with that, again, thank you for allowing me the few moments around these opening remarks. I look forward to the panel discussion and to the questions of people listening in today. But that's it from me, and I'm handing back to Sarah. Thanks very much.
Thank you very much, Suzanne, for those opening remarks. And yes, to encourage people to raise questions, provide comments, etc., as we move through this event this morning, today. So without further ado, I'd like to introduce our researcher, Charlotte Thumsner. Charlotte is going to present an overview of her research and the report. She is a recent graduate of the Master of Public Administration in Development Practice at UCD. Charlotte is passionate about promoting disability inclusion and has previously worked with children and young adults with intellectual and multiple disabilities in Germany. She's the proud sister of young women with Down syndrome. Charlotte also holds a BA in International Management and has lived, worked and studied in Germany, Ireland, Colombia, Ecuador, Rwanda and the UK. Currently, she is a consultant for the International Fund for Agricultural Development and a volunteer programme advisor for CBM Ireland. Charlotte, over to you.
Yeah, thank you, Sarah, for that nice introduction. And I'll pull up my screen for you and share a presentation. So I hope you can all see that presentation on the screen now. And then, yeah, really, I'm delighted to present the results of the study here today. And thanks to Susanne and Sarah for opening this event. So in the next 15 minutes, I'm going to give you an overview of the study, talking about the approach, the findings, and then also highlighting some of the recommendations that the report is giving. When we set out at the beginning of the study, we asked the question of how do international non-governmental organizations perceive their role in including persons with disabilities in program cycles and operations, and if disability mainstreaming is a part of their mandate. We further looked at how strategic and policy frameworks are in place for disability inclusion and wanted to identify specific efforts to mainstream disability. Looking also at achievements, limitations, and challenges to these efforts. And finally, we're interested in seeing if there's an influence through international and national policies on INGOs to mainstream disability. As Suzanne has mentioned, we had to shift our approach because originally we had designed a survey that was sent out to all DOCUS members, but due to the COVID pandemic, we had to adapt that later on in the process. Originally, we had planned to do follow-up in-depth interviews with selected INGOs, and then to complement all of this with desk-based research activities, such as a document review of annual reports and policies and strategic guidance. Through the adaptation, we did more in-depth interviews, but couldn't carry out the survey in the end. So our final sample included 16 key informants across 9 mainstream organizations and 2 disability-focused organizations. And as you can see on the graph here in the sample, there were organizations of different sizes and with different staffing, and they also had different focus areas. Furthermore, one Irish 8 member was interviewed in the process as a key informant. Then we came into the data analysis part, and all interviews that were carried out were transcribed and analyzed using a computer-assisted qualitative data analysis tool called 𝗏𝗏𝗰𝗏. We used an inductive approach to identify the key themes that were really emerging and coming forward from the interview process. And these themes are guiding the report, and they're also guiding this presentation. So coming into the findings, Looking at the strategic direction, we identified that disability-focused INGOs have a very strategic approach to disability inclusion, and obviously persons with disabilities are their main target group. They also have dedicated policies and strategies in place and work very closely with persons with disabilities. In mainstream organizations, there's a bit more of a diverse approach. Disability mainstreaming is widely recognized as a mandate, and the organizations have different entry points. While some that focus on human rights, for example, aim to reach the most marginalized and furthest behind, other organizations which focus on education and children, for example, use their target group to reach persons with disabilities as well. There's differences as well in how this is addressed in strategies and policies. Most organizations do not have a dedicated policy for disability inclusion, but rather include the point in gender equality policies or in general guidance on program cycle management. It was also brought forward that organizational champions for disabilities really have a huge role to play to push the topic high on the agenda and keep it visible. Looking at the action and the efforts that INGOs are taking in specifically development programming, there are examples of projects with a specific focus on persons with disabilities and of projects that reach persons with disabilities without specifically targeting them, both in disability-focused organizations and in mainstream organizations. And there is really a multitude of examples that were brought forward by each and every one of the organizations participating. And some of these are featured in the report and additional case studies were added. One example I want to share with you here is an example of a project in Uganda that was targeted at building capacities and confidence of young people to lead in the areas of governance, lobbying, and advocacy. And it wasn't specifically targeted at persons with disabilities, but as the key informant said, some of the participants with disabilities have now stepped up into leadership roles, and they have even been requested by other organizations to almost be like ambassadors, raising awareness around disability. I think that's a really powerful example of the work that is being done. Looking at disability inclusion and humanitarian response, and here I want to highlight that not all organizations that were part of the sample also work in humanitarian response. So there were fewer examples, obviously, but still a lot of them. Organizations highlight that they have systematic approaches to capture persons with disabilities and their needs and needs assessment, and they do so through consultations with the communities, also by partnering with organizations of persons with disabilities and disability-focused INGOs. The examples here focused on displacement, camp accessibility, and wash or sanitation facilities, and were mainly around persons with physical disabilities. Coming to measuring impact for persons with disabilities. It is important to highlight that all INGOs describe that they reached persons with disabilities through their programs and projects, but also not all of them said that they're actually measuring this impact in data that they can pull out and systematically describe. So that is something where there's an area of improvement. However, systematic data collection is increasing, and 5 organizations have mentioned that they are either currently using the Washington Group questions or are trying to integrate them more into their work. One quote from a key informant here is that I think I haven't seen the actual data being analyzed. I haven't seen a report because it is quite new, which does really highlight that this is an emerging field, but that more needs to be done to actually see how this data can be valuable. Mainstream organizations also mention that data disaggregation by disability status is only done sporadically, and that they are not always reporting back to donors. Disaggregating by disability status. This is different for disability-focused organizations where disability data is usually disaggregated by disability status. Coming now to drivers, challenges, and barriers to disability inclusion, and I want to highlight that 4 main drivers emerged. The first being the needs within the target community. Organizations express that the needs where they appear in their programming and in their activities really drive them to mainstream and include persons with disabilities. The second driver is an organizational responsibility based on the Convention on the Rights of Persons with Disabilities and the Sustainable Development Goals. And the All organizations are familiar with those documents, all organizations in the sample, and the convention really highlights the importance of disability inclusion both in development and humanitarian assistance. A third driver that was brought forward is a donor requirement for disability and inclusion. Some organizations that work with other donors, like for example, the Department for International Development in the UK or SIDA in Sweden, highlighted that those donors push disability inclusion more strongly onto the agenda, and that there is more pockets of good practices where there is stronger donor guidance. However, they also mentioned that in some Irish aid projects, they also report against disability, but that this is something that was discussed between the organization and the donor. And the fourth main driver is an organizational commitment toward disability inclusion, which is really important. And here I want to highlight a quote from the study. We have a responsibility, whether we have the funds or not, to mainstream it. So yes, I do think a lot of it lies at the doors of NGOs. This really shows that there is an awareness and an understanding within INGOs that there is a strong responsibility for the organizations to take action on disability inclusion. Now coming to some of the challenges. A challenge that was highlighted by nearly all organizations is the invisibility of disability. It isn't always easy to identify persons with disabilities among target communities, and sometimes they are hidden within communities. And where organizations don't have a particular focus on the topic, it will be hard to identify people with disability. Diversity of disability is another challenge for organizations, as there is sometimes this little knowledge about the different needs that exist, and persons with disabilities are not a homogeneous group. So there are different needs, different impairments, and also people have different lived experiences based on different personal characteristics like gender or sex, etc. And lack of knowledge and resources was brought forward as the strongest challenge, and where there's a lack of knowledge or there's no human resource dedicated to the topic, it can be hard to keep it high on the agenda. Data collection is something that returned and really was mentioned quite a bit, as I also mentioned before, but there's current efforts that really want to strengthen this field. Competing priorities, especially at the field level, were brought forward as a challenge, where organizations are tasked to mainstream for different topics like children, youth, or disabilities at the same time, and then struggle to integrate all of these into programming and design. And an organizational commitment, which is one of the main drivers, can be a real challenge where this is lacking. So where organizations aren't committed to including persons with disabilities, it's very hard to keep that high on the agenda internally. The following recommendations are made by the report, and I want to summarize them for your input. Driving change is the first recommendation, and as I mentioned before, donor guidance and resourcing is key and can have a lasting impact on the sector and on what is done. But the commitment and motivation within the sector is really the main driving force for change and can also influence donors and in what they are doing. Shared learning is key, especially highlighting that a lack of knowledge was mentioned as the most challenge that organizations experience. And currently there's little information on disability inclusion in public documents, such as annual reports. So we would encourage organizations to share more and increase their sharing of best practices, but also difficulties among organizations within the sector. Data is key, and the new data will hopefully make further evidence available on the prevalence of disabilities and the need of persons with disabilities. Additionally, the OECD DAC marker that was released earlier this year should also greatly increase data collection and reporting. Nothing about us without us is the key message of the disability movement. So we would encourage organizations to work in partnership with organizations of persons with disabilities and disability-focused INGOs, so that they can empower persons with disabilities to be agents for change. Resources and champions are very important and also were highlighted as one of the main challenges to disability mainstreaming and inclusion. We would encourage organizations to have dedicated human resources to act as disability champions that can drive change within organizations. And then last but not least, there is space for all. While some mainstream organizations perceive that this might be a task others are better equipped to do, it is really important to highlight that mainstreaming can only work when both disability-focused organizations and mainstream organizations work together to push disability inclusion. And mainstream INGOs should seek technical support and guidance from others if they need it. Finally, I want to thank everybody who was involved in this project, and especially thank the people that made their time available and a part of the study. So many thanks to Irish Aid, AidLink, CBM, Concern Worldwide, Gold Global, Mission Cara, Oxfam, Plan International, Self-Help Africa, Sightsavers, Tier Fund, and Trocker. And then I also want to special thanks to my supervisor at UCD, Dr. Flavia Santos, and the team and the other contributors who were involved in this report, Mary Keogh, Caroline Jago, Sarah O'Toole, Mary O'Connell, and thanks to the Disability International Development Working Group. Thank you very much for listening to the presentation, and I give back to Sarah.
Thank you very much, Charlotte, and well done again. I must share with everyone that Charlotte went over and above in her efforts to conduct this research and pull this report together in the face of COVID and the restrictions that brought about. So congratulations again, Charlotte. Just to let you know that we have posted the link to the research report. It's now available on DOCUS's website, and Louise has kindly posted that link in the chat box. I see there's also a request for a copy of your presentation, Charlotte. So hopefully we can make that available afterwards as well to participants. Just to remind people, please keep your comments coming in the chat box, but more importantly, your questions in the Q&A function here, and we can work our way through them once all our speakers have spoken. So now I would like to introduce our next speaker. And our next speaker is Oussama Eid from Plan International in Jordan. Oussama works with Plan International as child protection and gender-based violence specialist and has been working with Plan Jordan for 3 years. His experience on disability inclusion began in 2018 when he was appointed co-lead for the Plan to Inclusivize Inclusion Through Sports and Play program and is the disability inclusion focal person for Plan Jordan. He leads on several trainings on Plan to Inclusivize and the Disability Awareness Toolkit. He also represents Plan Jordan at the Disability Inclusion National Platform in Jordan. So Oussama, you're very welcome. I'll hand over to you now for your piece.
Thank you so much, everyone, for
if you could just turn your
kind...
camera on, please, Oussama. Sorry. Yeah.
Yes,
Thank
sure.
you.
Thank you. So it says that I can't open the camera. So okay, now it's working. So yeah. Okay. So thank you everyone for inviting me to this e-meeting, and I'm really glad, looking forward to share our experience as Plan International regarding mainstreaming disability inclusion. Okay, so I would like to share my screen first. Okay, sure. So, okay. Okay, so can you see my screen?
Yes, Oussama, thank you.
Okay, that's great. Okay, so just I would like to start with a few points that I'm delighted to be here with all of you at the launch of your research today, and to share some of the experience that we have in Plan International Jordan in mainstreaming disability inclusion. And you will get an opportunity to appreciate that our approach is very much in line with the recommendation that are made in this report. And given the commitment and funding to do so, disability inclusion can easily be mainstreamed into our work. So let's start our journey as Plan International Jordan in a learning journey in disability inclusion. Okay, so I will start with what are the global resources that Plan International have under the disability inclusion. So first, I will start with the Plan to Inclusifies. Plan to Inclusifies is a program that believes in the power of the sports and how that can bring a positive change. So as my colleague mentioned in the introduction, that this the Plan to Inclusifies is inclusion through sports and play. And the aim of this hands-on manual is to encourage and contribute mainstreaming inclusion in development and humanitarian program with objective of building inclusive societies. Then I will move to the next next resource that we have, which is the Disability Awareness Toolkit. So as you can see, this is the Disability Awareness Toolkit is a friendly user toolkit that you can use to discuss the type of disability, what are the positive attitude, negative attitude, skills and job, and helping aid for people with disability, and how to establish a dialogue within the community and to bring together, most importantly, people with disability and without disability to discuss this loudly. And as you can see, that the aim is to provide the community staff and volunteers and also community members with a method to collaborate with the community, increasing and understanding the rights and needs of people with disability. And after that, the participant who received this sessions will be able to identify people with disability, reflect, which is really important to challenge the stereotypes about our attitudes toward people with disability and so on. As you can see in the picture, this is one of the sessions that we are doing in reality, how we have the discussion and everyone is included, and also how we do simulation. Moving on, I would like to talk about the guidelines for consulting with children with disability, children and young people with disability. I would say that this resource simply emphasizing on this key message, which is nothing about us without us. This is really important, as we see in the result of the research, that it's really important to consult with children and young people with disability and let them decide on their own and what are their needs and what are the barriers that they're facing. So in this manual or in this resource, you will find a hands-on and practical guidance to do so with people and children with disability. Last program guidance that we have, which is the strengthening support to girls with, girls, boys, and youth with disability. And it's like, as you can see in the right hand, is a checklist that supports the programs manager and the directors and also the project staff to go through this checklist and to make sure that they are not leaving any important point in different level of designing and implementing and so on, just like the project cycle. Also here you can see just like few before we go into the mainstreaming in practice. So you can see also some of the picture that I will be talking on later on. On the right hand, you can see one of the Plan to Inclusifies training session, which is taking an action to bring people with disability with people without disability to play together with the same fun and challenging environment that they would like to be in. Okay, so I will end my presentation with going through some best practices that we have as Plan International. Okay, so first, ensuring that people with disability, male, female, are included in different stage. So for example, I will start with the example that in Jordan, we have conducted an assessment before we start a project in Azraq refugee camp, which is in Jordan, hosting the Syrian refugees. So we have done this assessment to ensure that also we identify the barriers and adapt our activities and our procedures accordingly. Second, regarding the allocated budget, which is really important, there's that we need to allocate budget for that. Disability inclusion is not just like a free thing to do. We have some alternatives, but we have to ensure that it's there. We have allocated budget for that. For example, we have budget for the accessibility, we have budget for the disability awareness raising, the trainings, the assistance support for people and children with disability, and finally appropriate transportation, for example, that's what we have done as one example in Azraq Camp and other places in Jordan. Also, I would like to highlight the M&E part, which is really important to be sensitive towards people and children with disability. So, for example, we are using Washington Group question in plan registration form to ensure that we are using appropriate language with people with disability, and also that to have disaggregated data for male, female, and male with disability, female with disability. Moving on to the mainstreaming disability inclusion in the activities. For example, that we ensure that we have activity to enhance and increase the awareness and capacity for the government and interagency actors in relation to disability inclusion. For example, we are going to launch the plan to inclusifies after we translate it into Arabic now, to have a national core team from government and interagency to be a core trainer in Jordan, and then we're thinking to expand regionally. Moving on, just like the ongoing advocacy on disability inclusion in relevant working groups, and we are open to share our resources. So all of these resources are, as my colleague say in the beginning, that we are not keeping it on the shelf or just like somewhere on the software things. No, it's there. We are open to share, to collaborate, and to do alliance towards including everyone. Also ensuring that, I would like to share an example of sharing the resources that a colleague from ACTED contacted us as a plan to use or utilize disability awareness toolkit in Libya, where we have no operation there, but we are open and we discuss them and we support them to start and to use this resource and promote disability inclusion. Finally, promotion of people with disability when recruiting. So for example, one of our training on plan to inclusifies in Africa, we ensured that we recruited people with disability as a co-trainer, and we pay them to be the voice of people with disability with reasonable accommodation. So finally, I would like to end with this, that let's inclusifies, and in Plan Jordan, this is how we have mainstream disability inclusion in practice. And in fact, I would recommend that other INGOs could also use approaches with the support of donors like Irish Aid and so on. Thank you so much, everyone, and thanks for your time. I'm glad to be here.
Thank you so much, Osama, for the presentation, and thank you for joining us today.
Thank you.
Just a reminder to people, we have some questions coming in there in the Q&A function, and also for your comments through the chat box. Our next speaker, I'm delighted to welcome Michelle Winthrop from Irish Aid. Michelle is Policy Director with the Development Cooperation in Africa Unit with Irish Aid, with overall responsibility for disability. Previously, she was Climate Policy Lead there, and prior to joining Irish Aid, Michelle has substantial overseas experience with Farm Africa and has also worked with 𝗵𝗿. So Michelle, you're very welcome. If you would like to turn on your camera and your microphone, I'll hand over to you.
Thank you so much, Sarah. Apologies, colleagues, for joining late. Unfortunately, I had a diary clash. Listen, thank you so much for inviting me to this webinar. It's fantastic, and I'm really delighted, on behalf of the Department of Foreign Affairs, to welcome this report. I think it really gets to the heart of how INGOs, and indeed the broader development community, can make progress on including disability into their work at all levels. It's fantastic in particular to see so many NGOs and academics, indeed, as well as government agencies, collaborating on this agenda. It's really something to welcome. I'll start with an African proverb. They say, if you want to walk fast, walk alone. And if you want to walk far, walk together. And I think that's become very clear to us, very apparent in recent months. The COVID-19 pandemic has altered our operating context, perhaps for a very long time. It has exacerbated inequality, and I think it really has reinforced the need for a focus on inclusive development, global solidarity and interconnectedness. And I suppose that's the sort of backdrop, I think, to some of the remarks I want to make today. The numbers falling into extreme poverty globally are really worrying. In the last year or so, the World Bank estimate that between 88 and 115 million extra people have fallen into extreme poverty. And indeed, that could even reach 150 million by next year. Add to that the compelling statistic that's in the report that 15% of the global population experience disability of some sort, and 80% of those live in developing countries. So the numbers are stark in terms of how we need to redouble our efforts on inclusive development and indeed how we specifically address disability within that. As you know, people living with disabilities experience physical barriers, and often that's the exclusive focus of disability inclusive development. But indeed, as you also know, those barriers extend to attitudes, to communication, to institutional barriers. Often there are policy and legal barriers. And really there are layer upon layer of multiple aspects of discrimination that people experience, leading to greater exclusion and increased risk. And again, the context of COVID-19 has really heightened that, has made that more of a factor. And the report is very gracious in referring to our international development policy, A Better World. And as you know, that makes a commitment to the rights and needs of vulnerable people, and specifically recognises people with disabilities. As you also know, A Better World makes an explicit commitment to reaching the furthest behind first. And really, from the perspective of the Department of Foreign Affairs, we want that to inform our approaches to development assistance, but importantly, it informs the policy positions we take within the European Union, within the UN, including, of course, the Security Council, which we're about to take our seat on, and with international financial institutions like the World Bank and so on. We're very conscious that we need a twin track approach. Disability is, of course, a cross-cutting issue, along with several others. But of course, it's also important occasionally to shine the light on specific disability issues and to work with organisations of people with disability as well. From our perspective, it is really important also that we don't create barriers to equality of participation excuse me, by people with disabilities. And that principle of do no harm really is extremely important to us. Turning to the report then, there were a few themes and a few issues that really kind of resonated and I wanted to highlight. One is this point about intersectionality. It's a terrible term, but effectively the fact that people who struggle to achieve their rights, who are living with disabilities, often experience other dimensions of marginalization and exclusion. The specific issues of women with disabilities have been raised, specific issues around children who have disabilities. In many cases, people from specific ethnic groups are marginalized. In some cases, there are political issues. In many cases, people who are refugees or internally displaced who have disabilities experience a heightened degree of risk and struggle the most to have their voices heard and to realise their rights. So it's not easy. It makes planning for these target groups difficult, and it particularly makes policy positions difficult. But I think we owe it to our commitment to the furthest behind first to really reflect that complexity on the ground and highlight it wherever possible. The report also highlights the point about the diversity of disability. In addition to the actual disability experienced, that diversity plays out in different country and regional contexts. And of course, in different people, individuals react differently to the constraints they face. And I think it's important that we reflect that also. The point that the previous speaker referenced, this nothing about us without us principle, it strongly resonates. And as many of you will know, bringing grassroots or authentic voice to the table of kind of high policy is something that we often do within the department, and it's something that we feel very strongly about. Disability, of course, is no different, and we're very conscious that we need to redouble our efforts really in getting those voices of people with disabilities to key international fora. Of course, in Ireland, as you know, our equality legislation it outlaws discrimination against people with disability, and of course the Disability Act gives that legal legal compulsion really to make sure that people with disabilities are not discriminated against in public services. A key point there, though, is around reflection of diversity in the workforce of both the public sector and indeed the CSO sector. I myself am part of a social inclusion working group in the Department of Foreign Affairs, and really our message to very senior management in the department is that an inclusive workforce can deliver better, in fact, than a non-inclusive workforce. And the role there of champions is a really important one too. The report highlights the importance of data. As we all know, getting good data is key to making progress. We have made the commitment to the DAC marker on disability, and I do genuinely think that will incentivize us to collect more and better and more granular data, and that data will drive a more assertive approach to mainstreaming, and I think will inform partnerships. Importantly, though, I think it will inform learning, and that learning point is really very important. The report speaks about donor guidance, and I have been in touch with some DOCUS members about the process to update our own guidance as Irish Aid for grantees and for partners around mainstreaming disability into work, both development and humanitarian. And I think it is important. It does, I think, rise the standards in the sector generally, and we've made a commitment to work with various stakeholders on making sure we get that guidance right. That said, I think it is important to signal that while we have a normative role as a donor, we are very committed to a flexible approach to funding. Many of you will know that, for example, that 50% of our humanitarian funding to NGOs is unearmarked, and a similar proportion is multi-annual too. So it's really important for us that INGOs are empowered to approach disability mainstreaming in a way that makes sense for them and in a way that is suitable for their operating context. And we would be generally very supportive of that. I think the donor guidance point also, however, needs a little bit of nuance too, because as many of you will know, as the Irish government, our money is important, but it's not all that important. In many cases, our voice matters almost more. For example, Ireland, as a member of the SURF Advisory Board, and indeed as a strong voice within 𝗂𝗎, have really pushed very hard for disability to be considered as a key pillar before allocations of funding is made. So I think we have a role to play to influence the broader system within which we seek to see disability inclusive development realised. Many of the findings of the report, of course, are either aligned with or speak to elements of A Better World, which is fantastic. Many of you will know we have been very strong supporters of the SDGs and indeed have ratified the Convention on the Rights of People with Disabilities. And I think our national strategic framework as well, really signals that as a government we are very committed to the issue and indeed well placed to help make progress. I want to end on a positive note. I think it is safe to say that progress really is being made. I think on this nothing for us without us agenda, we are managing to get authentic voice to the table more and more through our collective efforts. And I think this point about space for all, it is an area where I'm seeing a phenomenal amount of very collegiate and very constructive collaboration right across the sector. It is fantastic. And I think the disability, if you like, group can really lead the way for the sector as a whole in terms of this really horizontal approach to learning and very collaborative, as I said. However, I think the progress we have made at a global level really does need to be matched at a delivery level. And I think that's where we should really redouble our efforts at this stage. The question I would pose to the group is, how can we be more ambitious in terms of the results we can deliver for people with disabilities, and really breaking down some of those barriers I mentioned? What can we demand of national partners? How can we really push the agenda at national policy level, for example? And indeed, how can we influence the broader multilateral system as a group? Obviously, central to that is putting people with disabilities in the driving seat of change. And how do we really facilitate that and make that possible? I think a really important part from our perspective is to embrace the diversity of experience and couch our work in really solid contextual analysis. The questions around disability really speak to the rights-based approach, and I think that's something we're very, very committed to. I think that the rights space is an important area where we can really make progress. Another area that, as you know, Ireland has taken very seriously is the role of CSOs, and if you like, the caucus on disability really does reinforce the important role civil society plays in national development processes. So how can we use efforts to strengthen civil society space as a means to push for more ambition on results for people with disabilities? So that would be my last plea to you all, is to really think about how we can bridge that gap between progress at global level and perhaps some sluggish progress, if I'm honest, at national level in developing countries. How can we really get to those 80% of 15%? How can we get to those people and really make a difference in their lives and genuinely deliver results for that group that are furthest behind, perhaps most furthest behind of all? I will leave it there. I hope I haven't spoken too quickly for the sign language colleagues, but thank you so much for your time.
Thank you so much, Michelle, and I think I really welcome your request to your question around how can we be more ambitious, and I'm delighted to hear about your recognition of the need to redouble efforts around bringing the authentic voice of people with disabilities to those different fora. I think that is a real powerful thing to do as well. So thank you for that. A reminder for people to keep your questions coming in for Michelle and our other speakers. I now want to introduce our final speaker, who is 𝗶𝗶𝘀𝗁𝗆 from the Uganda Youth Network. They're a partner organization of Oxfam in Uganda. Penny is a program officer for policy and governance with the network. He is a Goalkeepers Fellow, an Africa Leadership Institute changemaker, and an active citizens global mentor with the British Council in the UK. As an active citizen, Penny has demonstrated a deep passion for innovation, mainly civic tech, to enhance more meaningful youth participation in governance, accountability, participation and performance, to enable them effectively engage in budget development processes for better access to health, education and agriculture as some of the key youth priorities. Penny also uses the active citizens model to build the capacity of youth and youth leaders to be natural community builders, curious learners and observers, and micro and macro thinkers. Penny, you're very welcome. I will hand over to you now. Thank you.
Thanks very much, Sarah, for inviting me and giving me a chance to speak now. I'm very glad to share our experiences on how we are including people with disability in our program called Youth Igniting Change. Uganda Youth Network, with funding from Oxfam and Irish Aid, we are implementing a 5-year project that is focusing on empowering young people to have a voice in influencing budgeting and planning processes. And most importantly, inclusive budgeting. You find that most of the time in Uganda and many other African countries, budget allocations are usually not inclusive in terms of the people that need it most. The young people, the women, the people with disability. So a case for this project, we have one young woman and one young male who are both visually impaired. It may be challenging. How do we involve people who are visually impaired to participate in some of these advocacy programs where they need a lot of evidence, where they need a lot of information to influence their decisions? So a project in Uganda, we have been able to empower the 2 visually impaired young people and many more others, but these ones have emerged out to be a big success, a beacon of hope for the many young people who are within the disability sector. So Mercy Monica and 𝗏𝗏𝗃𝗀𝗃 Chris, like you saw in the report which was shared, are some of the young people who have taken a step of advancing and advocating for inclusive budgeting. Inclusive budgeting is not budgeting based on what you assume, but inclusive budgeting is budgeting based on generating data to find out that in this community, we have this number of people with disability, and in this district, these are their specific needs. And therefore, when you're planning, you do not just say, okay, these are young people who are PWDs. They have a diversity of disabilities. So Mercy Monica and 𝗏𝗏𝗃𝗀𝗃 have been some of those key resource persons who have taken on leadership positions to, first of all, empower the people in decision-making positions to understand what is disability. When you are planning for me, what do you have in mind? But most importantly, to also inform the decision makers how disability planning and budgeting is done. Disability has diversity of many categories, but also disability has different needs based on the seasons. So with the support of 𝗏𝗏𝗃𝗀𝗃 and Mercy Monica, who have sat in these leadership positions, who have sat on these committees, have been able to share their experiences. That disability is not inability. And also, in as far as financing is concerned, we need to allocate resources that can make us all equal and be able to advance some of these priorities. A case in point is Arua, where Mercy Monica sits on the City Authority Council, representing women with disability. And 𝗏𝗏𝗃𝗀𝗃 also sits on the Disability Council, where he is representing the general women and male and female with disability, but mainly the young people, the youth. And that as a result of their involvement, they have been able, first of all, to influence resource allocation in Arua district, whereby to ensure that the budgeting and planning in the agriculture sector is inclusive. It's inclusive in the context that when you're planning for the needs of a person with disability, you also need to plan for the caretaker. When you are planning for the programs and the basic necessities of people with disabilities, your construction plan, your budgeting plan, your timing, your processes, the way, the approach you use is all inclusive in nature. And this is how we have been able to see much more results under this project because of the two people who have been able to participate and effectively influence decisions. Also, this has not been stopped in one district. Mercy Monica and 𝗏𝗏𝗃𝗃 have been a beacon of hope to many more others who are saying disability is not inability. Despite the negative norms people have about people with disability, despite the attitudes, despite the thoughts, despite the perception that they have about these people, they have potential to be somebody. They have potential to influence change. They have potential to give knowledge and ideas that can actually create the change you want to see. And we have seen it in the 5 more other districts. People with disabilities coming up to sit for leadership positions, to say that don't define me by what you see me. Define me by my ability to create a change and address the challenge I am seeing in society. And that has been a top of the community. Right now, Uganda is also going through an election period. And we have about 7 young people who have been part of this project who are contesting for leadership positions. This is not a position for being a president, but it's a position for being a position for influencing local issues, the local council disability structures. That's number 1. The local council women structures. That's number 2. The local council youth structures. And because of the increased confidence, it has given them the courage to say that, yes, we can also create a difference. If I don't have the arms, I have the mind. If I don't have the eyes, I have the ears. If I don't have the ears, I have the hands and the legs, and I can speak. If I cannot speak, maybe I can write something on down. I can write my mind, and somebody can get a point in what I'm saying. This is how we have been able to influence the local council planning and budgeting processes to create an inclusive budgeting and planning processes. Thank you.
Thank you so much, Penny. I think just a great example there, following on from Michelle's words of what's happening at national level, and we need to hear more about these stories. And I really like your piece around disability is not an inability, and about the ability to create change in a leadership role. I think it's also worth reflecting here today that because we're doing a lot more virtual pieces, that we can have Penny and Osama here with us today. Where in the past it would have been more of a challenge with flights and visas, etc. So it's really, I think, a real positive thing that this virtual world and these new ways of working have brought for us. So that concludes all our speakers. We do have some questions now for our panelists. And I will just, there are some questions that have come in for Charlotte. And I'll just try and summarize some of them. One was a piece around governance as a big role in driving organizational change. Did any of the respondents reflect on the participation of people with disabilities on their boards? And also a piece around, a question around the attitudinal barriers within organizations of staff themselves. So, did that come up as something that needs to be addressed within organizations? Charlotte, if you would like to take those. And yes. I could ask all speakers, sorry, just to turn on your cameras now so we can have everyone back on the center here.
Of course, okay. Answering to the first question first, in terms of governance, if I remember correctly, it was brought forward that there was one organization mentioning a board member that I don't think was a person with disabilities themselves, but was really championing it within the organization, keeping it high on the agenda, and that had a positive impact on the organization itself. And then to the second question on attitudinal barriers, from the conversations that I had, it wasn't brought forward as a problem, more so the fact that some persons might not be aware of the needs and of the prevalence of disability in programming. So rather an unawareness than a negative attitude towards people with disabilities.
Great, thank you, Charlotte. I also have a question for Michelle. Michelle, could you maybe reflect on what you think might be the greatest challenge in 2021 for the sector, for disability mainstreaming for the sector next year, in light of COVID this year and disruption to a lot of our work. Is there any, have you had time to think about what you think will be the greatest challenge to advance this next year? Big question.
Sure, do you want me to address that now?
Please, thank you.
I actually think the pandemic is a big challenge, because to be honest, we're also focused on the health response, and we're so focused on the kind of wider societal implications of the efforts to control the spread of COVID and to manage it, that I think the specifics around those who are marginalized do risk getting crowded out. You know, I do, that is very definitely a concern. Opinion is divided as to whether COVID-19 shines a light on those who are most marginalized or indeed leaves them forgotten. And I think there's a real risk it's the latter. So that is the biggest concern, really, is the kind of meeting the new needs, evolving needs of the masses in response to this unprecedented time does risk crowding out the people with disabilities. Can I also just mention something about the wider awareness point, even though the question wasn't addressed to me? And I mean, that's something we're trying our best to do in the department, actually. We have, as I mentioned, this kind of internal group working to address inclusion more generally. And I think, indeed, we have some events coming up for staff to really kind of open their minds a little bit. But gosh, you know, I think there are a group of us internally in the Department of Heart Affairs who think, wouldn't it be amazing at some point to have an ambassador who has a disability, you know, as a real signal that we have the capability to embrace that diversity. So there's a target to set ourselves.
Great, we'll hold you to that, Michelle.
I'm not sure I can guarantee it.
Great, thanks for that, Michelle. And then we have a question from Anita had asked a question of Osama about experience with consulting with non-verbal children and how do you go about it? And I know you answered that. Maybe you could just reflect a bit on that, Osama. I need you to unmute.
Yes, thank you for your question. So as I already answered that, first of all, it's not easy, and we need to learn why it's important to include everyone, and then what are the, you know, the alternatives and solution to ensure that we are doing this with dignity and respect. So what we are doing, so at the first stage, we try to coordinate with the existing service provider in the area that we are doing. So if they have an expert on communicating with the non-verbal child with disability, definitely we seek for their support to ensure that he talk to them properly. Second, and sometimes, because why in the same area? Because sometimes this child might be a beneficiary in their center, so they know him, they know the history, they're familiar with him. So this is the first thing. Second, we try sometimes, if we are in just like remote areas or just like in areas that we're not working and we didn't have these resources, we try to outsource this and to see a service provider who have, you know, who can provide this kind of you know, any support in communicating with him.
Thank you, Osama. Thank you for that.
Thank you.
A question has come through for Penny. Does Uganda Youth Network have an accessibility and disability inclusion policy to ensure that the two visually impaired persons have an enabling environment to participate? There's two more questions. How does the network ensure that information and communication products and services are accessible to those two young people? And how do budgets address the sexual and reproductive health needs of the two young people? So there's a number of questions there, Penny, for you. I'm not sure if you're able to answer them all here today, but Yeah, maybe if you could just have a stab of there. If you could just unmute yourself, please. Thank you.
All right, thank you. I'll begin with if Uganda Youth Network has a policy for the people with disabilities. Yes, as one of the interventions that we discovered, we needed a policy. Even if we are not the 100% expert in disability sector, but we needed to have at least a policy that is deliberate on addressing and protecting the people with disability that we are working with. So on this note, we have a policy, and we had to do a lot of learning from the experts who are into whose organizations who are 100% focusing on disability, to see how can we mainstream, that's number one, but also have a clear policy that ensures every project that is being developed, right from the project design, data collection, reporting, we ensure there's a session of disability. Then the issue of how do we budget, how does the budgeting and planning processes respond to the sexual reproductive health needs of the two people, but also not these other ones, but the general young people with disability. Yes, we are so keen on not only agriculture sector, but we are so keen on the education sector, agriculture, and the health. And mainly health, we are looking at SRH financing, sexual reproductive health financing for the young people with disability, but also for the young adolescents in Uganda. So there is a deliberate effort to ensure that in our advocacy and budgeting planning processes, there is an affirmative action to ensure that government must provide enough resources to benefit the SRH needs of young people, but most importantly, those with disabilities. Our biggest challenge has been mainly the medical workers not able to understand the language, like the sign language interpreter, the ones who are able to support the health workers who have limited knowledge on, first of all, how to handle and understand the needs of PWD SRH needs. So there is a deliberate effort to ensure that in our budget advocacy, there is inclusion. There is a affirmative effort to ensure that SRH needs of people with disability is also considered. Yes, I didn't get the third question, so maybe you can.
Thank you, Penny. Thank you for that. I have another question coming in to Michelle. Thanks for the presentation. Inclusive design considers human diversity and requires addressing needs to begin with the most vulnerable. Universal design considers one size fits all. Which of the two or other designs guides your work on inclusion and mainstreaming persons with disability?
Great question. I mean, inclusive design is a principle that we would apply across all of our work. The age-old principles of participatory development still ring true today, I think. Of course, our design processes are always done with partners. At the end of the day, we are a government, we are a donor, so we rely on those principles and those good practices of partners. And that's why, for example, with the CSO community, you know, this common approach to trying to raise the standards around inclusivity in design is something we would be super supportive of. But we also try to push that agenda with other partners, with UN agencies, for example, and indeed with partners in country. So very much inclusive participatory approaches would be at the heart of anything we would be pushing for and seeking to fund, for sure. Thanks.
Thank you, Michelle. Charlotte, can I just ask you a question about the research and all the work you've been doing? Was there anything that stood out for you in your engagement with the INGOs during the research study that maybe hasn't been covered here in the report, or anything in particular you wanted to highlight?
Yeah, of course. So yeah, as Suzanne mentioned at the beginning, coinciding with the COVID pandemic was a bit unfortunate at the start to engage with organizations. But once we did get through to organizations, there was really great enthusiasm and really good engagement. And in multiple organizations, I was able to talk to a handful of people from different parts of the organizations and not just to one person. And so it was really good to see the interest from within the organizations to share their examples and really engage on the research with us.
Great. Thank you, Charlotte. A question for Osama. How does PLAN address the specific needs of girls with disabilities?
Sorry, address the specific need of girls with disability? Mm-hmm. Okay, so so for sure, when we're talking about inclusive approach, we ensure that everyone is included, male, female, and people, male with disability, female with disability. How we ensure that first we ensure that we outreach girls with disability, because in our context, for example, that specifically girls with disability are headed more like than boys, because it's it's shame and they're afraid of her and other beliefs. So we ensure that we try to leave no one behind and to outreach. This is one. Second, try to adapt our approaches. So for example, in some cases, if we are not able to join to bring them to the center due to whatever challenges, the parent consent or so on, we start first with the discussion with the parents. Second, we try to refer them to specialized service provider as a start, and there we can try to support and let them be engaged with their peers. And we ensure that sometimes, for example, we collaborated with a disability service provider. So we bring children without disability from our child-friendly spaces to attend to this rehabilitation center that it's only stigmatized, that it's only for people with disability, and there we try to break this stigma and to ensure that everyone is included there and they bring together and you are willing to go there and to have fun and to engage with your peers with disability and without disability. I hope I answered this question.
That's great. Thank you very much, Osama. Suzanne, could I just maybe ask you one final question? Is what concrete actions do you think can be taken to support the INGO sector here to advance on disability inclusion commitments?
Yeah, well, I suppose a couple of things. I think kind of this seminar itself and just getting the report together has shown just how active the DOCAS working group is on disability, and it's that collaboration, the fact that you're reaching out, different agencies coming together, and I'd really like to think that in the last few months, there's been more and more collaboration in different groups. So let's keep that energy going. Let's get more and more agencies involved. Secondly, I think, and great to have Michelle and IRISH-Aid kind of supporting this initiative and DOCAS in general, but it does speak to that need for partnership with government, with IRISH-Aid, also with businesses and other stakeholders. And I think in that partnership, we need to get smarter at finding those allies within these organizations. Just as we're seeing Michelle here, they're the ones that can really push things within these big institutions. So we need to work with allies within these institutions to make these partnerships really real. But last but not least, I think for me in DOCAS, one thing I was so proud to be part of last year was the DOCAS members coming together to go in front of the Joint Foreign Affairs Committee and doing exactly what we're doing here today, bringing those voices to people that wouldn't necessarily know these issues, be exposed to it. We put together a very, very short policy paper, knowing that politicians don't have much time, and I think it had a real impact. It speaks to that thing that Michelle said. This isn't just about money, it's about voice. We've got an opportunity here in Ireland around the Joint Foreign Affairs Committee, but I think next year we have to challenge ourselves a little bit more. We have to engage at the EU level much more. And we do have this opportunity around the Security Council seat. So I'd really welcome working with more of you guys on that policy dimension to work together to really get some strong messages out there based on this report. Thanks.
Thank you, Suzanne. And I think on that note, we can bring today's event to a close. I'd like to thank all our speakers, Suzanne, Charlotte, Osama, Michelle, and Penny. Thank you so much for your time in being here today. Thanks to all our attendees today for your engagement, and hopefully this is the beginning of more constructive and progressive discussions on this topic. Thanks to our sign language interpreters, Romeo Callahan and Helsa Bornstein. Thanks to our live captioner, Katie Ryder, who's been kept really busy today. To let you know that a recording of this session is available on DOCS's website and will also be on their YouTube channel. And an evaluation survey of this event will follow. I'd encourage you all to respond to that. And finally, just to thank DOCS for another great event. It's been brilliant this year to see all these voices coming together, real active engagement from the sector, home and abroad. So thank you all, and wishing you all a very pleasant afternoon. Take care. Bye-bye.